Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. The skin is the mirror of the body. A 67-year-old retired gardener presents to the dermatology department with a suspicious evolving freckle on his face, which he first noticed 10 years ago. On examination, he has a 3 cm asymmetric pigmented patch on his cheek, comprised of multiple shades of brown and black and with asymmetrical thickening of the lesion. Which subtype of melanoma is this gentleman most likely to have? A. Superficial spreading melanoma. D. Desmoplastic melanoma. C. Lentigo Maligna melanoma. D. Acral Lentiginous melanoma. E. Nodular melanoma. The answer is Lentigo Maligna melanoma. We have here a 67-year-old gardener. Gardener, it means that he had a long period of sun exposure. Is coming with a freckle on his face which started 10 years ago. It has the long duration, 10 years. On examination, we see a 3 cm asymmetric pigmented patch. Asymmetry is important in the melanomas, comprised of multiple shades, different colors of brown and black is also important in melanoma, and with asymmetrical thickening of the lesion. Asymmetry is another features of melanoma. The diagnosis here would be Lentigo Maligna melanoma because of the long duration of sun exposure place. Okay, nodular melanoma can this type is more aggressive type, and we can see in short period of time, not 10 years. Okay. Superficial spreading melanoma can also be the choice, but this one is not superficial. It's the specification is not for the superficial spreading melanoma, and the best choice can be Lentigo Maligna melanoma. Okay, here we are going to explain different types of melanoma specifications and presentations. Okay. Lentigo Maligna melanoma, suspicious freckle on face or scalp of chronically sun-exposed patients. Lentigo maligna is a precursor of Lentigo Maligna melanoma. It begins as a suspicious flat freckle which can grow over 5 to 20 years to develop into melanoma. It typically occurs in older people on chronically sun-exposed skin, example with a career in gardening, and develops the characteristics of typical melanoma like asymmetry, border irregularity, color variation, and diameter more than 6 mm and evolving. We are going to explain these characteristics below. Once it has become melanoma, parts of the lesion may thicken as occurred in this gentleman. There may be increasing numbers of colors, ulceration, bleeding, itching, and stinging also. Whilst nodular melanoma also presents on the face and neck, it is less likely given the presentation and the slow growth of the lesion, as we said. Superficial spreading melanoma would also be a differential to consider in this gentleman. However, the location of the lesion and the chronic mild nature of the sun exposure benefits Lentigo maligna. Okay, malignant melanoma. There are 4 main subtypes of melanoma. Nodular melanoma is the most aggressive type, whilst the other forms spread more slowly, as we said. Okay. Superficial spreading melanoma is 70% of cases. It's the most common. We can see it's usually in arms, legs, back, and chest of young people, as we said. It cannot be superficial spreading because it's in the face of the patient, and the face of the patient is we can see usually Lentigo maligna in the chronically sun-exposed skin in older people. Okay, we can see superficial spreading melanoma in arms, legs, back, and chest of young people, and it's 70% of cases. the most common type of melanoma. Nodular melanoma is the second most common type of melanoma, and as we said, is the most aggressive type of melanoma. We can see nodular melanoma in sun-exposed skin in middle-aged people. Okay, Lentigo malignant melanoma is the less common type. We can see it in chronically sun-exposed skin in old people, as this chronically sun-exposed skin is important in Lentigo malignant melanoma, as we can see in our patient. And Acral Lentiginous melanoma is a rare type of melanoma. We can see it usually in nails, palms, or soles in African Americans or in Asian patients. Okay, here we are going to explain these types of melanoma according to their ABCDEs. Okay, superficial spreading, most common, as we said, is here we can see superficial spreading melanoma is the most common form, as we said, often develops in previously benign mole, can be found almost anywhere. Most common place is as we said, in man is trunk, and in woman we can see it's in legs. Follows the ABCDEs or early detection. We are going to explain ABCDE below. 70% of all melanomas, as we said, is the most common type of melanoma. Nodular melanoma, the second most common type of melanoma is nodular melanoma, and the most aggressive type of melanoma is nodular melanoma. These are usually rise and firm to the touch, grows and spreads very quickly. As we said, it spreads very quickly and can be black, blue or pink, red. Defies many of the ABCDEs for early detection. It's 10 to 15% of all melanomas. The second most common type and the most aggressive type is nodular melanoma. Okay, Acral Lentiginous melanoma is most common type of melanoma in Asians and African Americans, as we said, can be found on palms or hands, soles of feet, under fingernails and toenails, and in the mouth and tongue, among other places. Is less than 5% of all melanomas. And melanoma of the eye here, melanoma of the eye is most uveal or ocular melanoma is melanoma of the eye, is the most formed in parts of the eye which we cannot see in the mirror. Early ocular melanoma hard to detect. Least common types of melanoma only responsible for 3 or less than 3% of all melanomas, as we said. And acral melanoma, as we said, is a lentigo malignant melanoma, as we said, is responsible for 5% of melanomas, near 5% of melanomas. Okay, there are other rare forms of melanoma, including desmoplastic melanoma, a melanotic melanoma, or melanoma erasing in other parts, is ocular melanoma, as we said. Okay, the main diagnostic features, we have some diagnostic features, which some are major criteria and some are minor criteria. Okay, major criteria including change in size, change in shape, and change in color, and minor criteria including diameter more than 6 mm, inflammation, oozing or bleeding, and altered sensation. Okay, here we are going to explain ABCDEs of melanoma. Here we can see benign mole in this part, and in this part we can see melanoma. Okay, A is for asymmetry. If the spot asymmetric, if you draw a line in the middle, one half does not match the other, as we can see here, asymmetry in this melanoma. And B is for border. Are the borders uneven? The borders are not well defined or are irregular in shape, or we can see the borders are uneven. C is for color. Does it have different colors? C is for color. Does it have different colors? Melanoma lesions are often more than one color or shade. Okay, here we can see different colors. We can see red, black, brown, and yellow color in some parts of this melanoma. And D is for diameter. Is it larger than 6 mm? Melanoma growth are normally larger larger than 6 in diameter. As we said, here we can see the increased diameter and evolving. If they are changing in growth, our Thai melanoma will often change characteristics such as size, shape, or color, as we said. Okay, here was A, B, C, D, E for their melanoma. Okay, treatment is usually suspicious lesion should undergo excision biopsy. The lesion should removed completely, as incision biopsy can make subsequent histological assessment difficult. Once the diagnosis is confirmed, the pathology report should be reviewed to determine whether further re-excision or margin is required or not. Margin excision related to bristle thickness. If the lesion is 0 to 1 millimeter thick, the thickness of the lesion is 0 to 1 millimeter, then the margin of excision should be 1 centimeter. If the thickness of lesion is 1 to 2 millimeter, then the margin of excision should be 1 to 2 centimeter, depending upon site and pathological features. If the thickness of lesion is 2 to 4 millimeter, then their excision margin should be 2 to 3 centimeter, depending upon site and pathological features. But if the thickness of lesion is more than 4 millimeter, then their excision of margin must be 3 centimeter. Yeah, we can see different types of melanoma. We can see asymmetry, we can see irregular border, we can see size we can see increase in size in diameter, and we can see irregularity in different types of melanoma. Okay, this was an explanation about different types of melanoma. Thank you for your attention.